You're listening to Honestly Aging by VigRHealth, a podcast where we explore what it's like getting older, the peaks, the valleys, and everything in between. In this season of Honestly Aging by VigRHealth, we're covering topics related to solo aging. I'm your host, Cheryl Proska. Let's grow old together. On today's episode, I'm joined by Kiristin Briggs. Kiristin is a board-certified registered nurse practitioner with over 15 years of experience in the nursing profession, including nearly 10 years as an advanced practice nurse. Kiristin graduated with her BSN from Bradley University in 2004 and obtained her MSN at LaSalle University in 2010. For 10 years, Kiristin has also maintained an adjunct faculty position at the Community College of Philadelphia. Kiristin has experience in primary care, internal medicine, med-surg, skilled rehab nursing, long-term care, and drug detox rehabilitation. In addition, she has been a legal nurse consultant expert witness since 2018. Kiristin, welcome and thank you for being here. How are you today?
I'm doing well, Cheryl. Thank you so much for having me. I'm excited to be here.
I'm excited to have you. So you're joining me today to discuss feeling our best as we age. We are going to cover hydration, nutrition, specifically focusing on the MIND diet, supplements, and exercise. So let's get started with hydration and why it's so important as we age.
So yes, definitely. It's an important thing to make sure that we are staying well hydrated. It's interesting because some people truly do not realize how crucial adequate hydration is to our overall well-being, mental and physical well-being. So our bodies are composed of 55 to 65% water. As we age, this amount decreases. And so we really need to make sure we're adequately hydrating. We typically lose fluid through our lungs, our skin, our kidneys, and our GI tract. And as little as 2 to 3% of fluid loss can really make us not feeling our optimal best. And so between 17 and 28% of elderly have increased risk of dehydration. And so it's a very common finding that we see in our elderly population. So it's just important to make sure we're staying well hydrated so we're really feeling our best.
So why does our hydration start decreasing, or why do we start having challenges with it as we get older?
So for one, it's thought that we have a decreased sense of awareness that we need to drink. So the average person where we say, hey, you know what, we are thirsty, we need to drink, that sense may decrease a little bit as we age. In addition, sometimes rather it be cognitive impairment or any type of memory loss, we may not necessarily remember to drink. And then there's also a component. We have this anti-diuretic hormone. So it's this hormone that kind of gives us this balance. And it's thought that that also decreases when we age as well. And so we lose more water without adequately hydrating to replenish it as well.
Can you go over what maybe some causes and some signs of dehydration, as well as what are some dangers if we are dehydrated?
So there can be various causes. It can be illness, it can be medications, various medications. If you're on a quote unquote water pill or what we may call a diuretic, we can lose fluid through that. If there are extreme temperatures, so you're outside, you're gardening or you're walking and it's 90 plus degrees outside. And I told you that, you can naturally lose fluid through your lungs and through your skin. And so high extreme temperatures, you're sweating more, you're losing more fluid. And then also sometimes when you are exerting, so you're exerting and putting out more than what you're taking in. So really you need to make sure that whatever you take out, you need to also replenish back. So that's rather it be before any type of activity or before any type of exercise, you need to be drinking, and then during that activity, and then after as well. And some signs and symptoms that you may be dehydrated. We find oftentimes that you have dry mouth, decreased tear production, fatigue, feeling a little brain fog or a little bit confused, also decreased urine output, and also dark urine. And I say that's really a good indicator on how well we're staying hydrated. So if you notice, you and I, we go through a day, maybe 8 hours, and we realize, oh my goodness, I haven't really been drinking, and our urine may be a little darker. That's an indicator right there. We should really be having nice, clear urine. So that right there indicates, you know what, I need to be drinking a little bit more. And I do want to say, obviously, some medical conditions or medications may affect that, but in general, it's really a good kind of thing to look at to make sure you're adequately hydrating.
What might be dangers of becoming dehydrated, especially for our aging population?
Sure. So it really affects every part of our body, from constipation, poor wound healing,
Yeah.
cardiac and kidney function, falls, urinary tract infections. And, urinary tract infections and falls are very common, unfortunately, in our aging population. So if we can at least do some things to help reduce the risk, that's good as well. We oftentimes will sometimes find that someone may have a urinary tract infection. From that urinary tract infection, they may become confused. From that, it may also result in a fall. So it's kind of a trifecta, and we really want to see what we can do to help minimize that.
It just sounds very compounding, and being able to provide some awareness of these signs and symptoms so individuals can start monitoring themselves, I think will be very beneficial.
It really is. So there's a study out of Arkansas actually in 2015, and it showed that there was a big gap in hydration health literacy amongst our older population. So it was really just that awareness and that lack of awareness. And also that same study showed that dehydration was a primary diagnosis in 2015 for the older population as well. So if we can help decrease that gap, provide more awareness and education and ways to help prevent dehydration, then hopefully we can certainly start to reduce that, as well as all the risks that can be associated with it.
Are there any specific challenges or barriers to the aging population with maintaining this adequate hydration we're speaking about?
There are. So, one of the biggest things, I will hear is, I drink, but then I have to go to the bathroom all day, or I'm out with my family and my friends, and, I just don't want to have to go all day. So what I always recommend is try to drink during the times that you're not going to be maybe out and about. So, let's say you drink the first half of the morning, or I'm not going to be going out until noon. Okay, I'm going to try to get a good portion of my hydration in the morning, and then maybe when I come back later on in the day. The other thing I sometimes hear also is, I drink and then I'm up all night going to the bathroom. Another thing I say for that is try to do a cutoff time. So let's say if your bedtime's 9 o'clock, maybe cut off drinking around 6 or 7 and decrease that amount as well. The other thing I say is, the preference is to hydrate mostly with water. Not to say you can't have juice and other beverages as well, but when you start drinking the beverages that are caffeinated, those are kind of natural diuretics. So they're going to make you go to the bathroom more. Your body needs water and supplements with water as well. So, a lot of times that can be a little bit more tolerated than some of the drinks that cause a natural feeling to have to go to the bathroom. So that's also a recommendation too. But, there are a lot of challenges, and I know it's not easy. We're kind of going day to day and needing to try to get tasks done. We can't stop every 5 minutes to go to the restroom. So those are some challenges and some tips that sometimes help people overcome that.
And it's starting a new habit, and that can be hard. However, the longer you do it, give yourself some grace if you don't do it so perfectly your first try. Yes, just keep trying and the habit can get formed.
I agree. And, I tell people that as well. You don't need to jump from, you know, drinking tons of water, but really just like you said, a habit, starting having some hydration, increasing that, and then realizing that you feel so much better when you're well hydrated.
And that's a perfect segue because I did want to ask you, a well hydrated body, why is this so beneficial for us? And also, how much water or hydration is recommended for us?
So I know I keep stressing it, but we need hydration to function. Our organs need adequate hydration. So we need it for adequate blood flow, for lubricating our joints, for good cellular health, to help decrease infection, for good kidney health and cardiac health. So we just need it for every organ in our body. And if we don't hydrate, it starts to reflect that.
Mhm.
And in terms of how much we should really be drinking, I want to start by saying that is very individualized, and you really should discuss that with your provider. And the reason why I say that is because, once again, various medications, various medical conditions can really alter the amount that you may need to drink, or you may need to drink a little bit less. So on average, you want to drink at least 48 to 64 ounces of fluid a day. Again, for me, I tell my patients, okay, if you told me that you usually consume 12 ounces of water a day, that's not a
Mhm.
lot. But I'm not going to go off and tell you, okay, well, now you need to do 64. My goal for you would maybe say, let's start by trying to double that. So let's maybe try to get 24 ounces in, or 24 to 30 ounces in. And of course, it's individualized with me knowing what their medical conditions are and just kind of setting realistic goals for them. And then they can maybe work to what our ultimate goal would be in terms of getting a little bit more hydration in. And 9 times out of 10, when I speak to them again, they feel so much better just being hydrated.
And I love how, as a provider, you meet people where they are. You're not so strict to, well, this is what the medical journal says, and of course we have to follow it. You know what you need to know, but you have someone who comes into your office and you treat them as an individual, and that must just be such a wonderful experience that you're providing.
It really is. And it's never black and white. There's definitely an in between. And we have to make sure we're really individualizing our care, because it's very important that one person isn't going to be the same for the next. So you just have to be mindful of that and make sure we're really kind of catering to the needs of the specific patient and individual.
So now we know how to keep our bodies hydrated and feeling great in that regard. Let's move on to nutrition. And I'm so excited to learn from you about the mind diet. So, can you share with us about this subject?
Sure. So the MIND diet, that stands for the Mediterranean Interventions for Neurodegenerative Delay. And what that is the combination of your DASH diet, which is dietary approaches to stop hypertension. So recommendations for those that are diagnosed with hypertension, or those that we want to help reduce risk for hypertension. And it's coupled with the Mediterranean diet. So these two have been combined, and there is a professor, or was a professor, out of Chicago, Dr. Martha Morris. And in 2015, she did fascinating research on this diet, and she developed the MIND diet, and it showed that this diet overall improved brain health and decreased risk for Alzheimer's and other age-related cognitive decline. And Alzheimer's accounts for 60 to 80% of dementia cases. And so knowing this research was really fascinating, and to know that there can just be some diet changes that can really help reduce the risk is great. And so, she looked at this and she passed away, but there's still continuous research and studies on this to show that this really is beneficial.
So, what are some of those diet changes you mentioned, or what foods consist of the mind diet and why?
Sure. So some of the foods that consist of the MIND diet would be like your lean meats, poultry, seafood, fatty fish, your berries, so strawberries, blueberries, raspberries, whole grains, beans, olive oil, your healthy nuts, so like your walnuts, unsalted walnuts, of course, your walnuts.
We don't want to get dehydrated.
Exactly. So your salted or your unsalted walnuts. And then also wine in moderation. And again, that's at the supervision of your provider because various medications interact with alcohol, but it does show that wine can provide some benefits as well. And so what these foods have are various vitamins and antioxidants that have shown to decrease inflammation and also provide cellular health. And then in addition, you're eliminating your trans fat and your saturated fats in your sweets. So those trans fats and saturated fats over time have shown to cause decreased cognition. So avoiding that has obviously will show some improvement as well.
Would you prefer to age independently in your own home or live in a nursing facility? I know what I'd rather do. Friends Life Care membership offers just that. Plan today for a future lived at home with vitality, independence, growth, and resilience while protecting your savings. Learn about your options at a free seminar or webinar. Register at friendslifecare.org/register or call 215-628-8964. So if we wanted to get something sweet, because my understanding is that as we age, we do lose a little bit of our sense of taste. And so I know that some older adults really go searching for those sweets and have a sweet tooth. Is there any way to get our fix, for lack of a better word, through the MIND diet?
Sure. So, I will say everything in moderation. So, if you're out with family and you want to have kind of a cheat day with a little bit of a dessert, I think that's okay, as long as, you don't have other conditions such as diabetes where you should kind of be avoiding that. But, I think that's okay. But then if you kind of want to look at some things that you want to maybe eat a little bit more regularly. Of course, I'll say the cliche fruit. So, frozen berries, those are always good to suck on or to eat, or making a smoothie with having all of the, healthy ingredients in there, because you can add green leafy vegetables, you can add the berries in there. And then also just kind of some modifications. They always have those, I know at Whole Foods, they have those little small kind of sponge cakes using a little bit of whipped cream and berries on top, and you can kind of have your sweet fix there as well. So there are some various ways to kind of still get your treats in and do it in a healthy way, as opposed to, maybe choosing, I'm not a big sweet eater, but, the bag of Oreos or anything like that. So kind of avoiding that. And then if you want to have 1 or 2 Oreos, that's okay as well, but just making sure it's in moderation for sure.
And just hearing that, just doing things in moderation, I think it's just helpful to hear it, because if you deprive your body of something, or your sweet tooth or whatever it is that you enjoy, then you are going to maybe face up against eating so much of something at once because you feel you've been depriving yourself.
Exactly. And just be realistic. I mean, we still can follow and adhere to a healthy diet and say, Thursday is going to be my day that maybe I'm going to have a scoop of, sorbet or something along those lines, or something that you really enjoy. That's okay. But it's also not picking the largest piece of pie out of the bunch, but, just having it in moderation. And I think that's okay. We have to live a little bit. So
Just a little.
yeah, just a little.
So there's always conversation around supplements. Should we take them? Should we not take them? What are some benefits? Are there dangers? So from a healthcare professional, can you just give us some of your knowledge on this topic?
Yeah, so the verdict is still out there. There's still mixed reviews with it. I will say that. But I will say that we usually recommend that unless you have a deficiency, you do not necessarily need a supplement.
Okay.
Now, it's not to say that some, can't take it, but we look at where the deficiency is, and that's when we usually want to replete that. So a lot of times we say, what's best? Try to get it through your foods, your fruit, your fresh fruits, your fresh vegetables, your lean meats, your let's see, your lean meats, your fresh vegetables, fortified cereals as well. There's some beverages that have it fortified as well. So trying to look towards there to get those supplements and vitamins are the best way. So I know the Academy of Nutrition and Dietetics, they really look at your vitamin D, your B12, your vitamin K, fiber, and calcium. And they find that those are important vitamins and supplements that you don't want to be deficient in. And a lot of times you can find that in your diet. So if you go to your primary provider, a lot of times in your routine panel for like your physical, let's say, you will get your vitamin D checked, you'll get your B12 checked, and some of the important vitamins as well. And your vitamin D is really important because it helps with heart health, blood pressure regulation, bones in your brain. And then with B12, that helps reduce risk of stroke and also dementia as well. So it's really important to look at some of the vitamins that are linked to other health concerns and conditions and seeing if it needs to be supplemented in that way.
Are there any dangers to taking supplements?
So there really can be,
Oh.
actually, especially if you're on other medications, because some of these supplements can interact with medications that you're on.
Hmm.
So we have our aging population and they're on various medications. You want to be careful with those supplements because they may interact. And actually, the labels don't have to list all of the ingredients. So there may be some hidden ingredients in these supplements and vitamins that you may have an interaction with or have an adverse reaction to. So there can be some dangers. And I would certainly say do not start any supplement or vitamin without speaking to your provider first. You may call your provider and say, I think I need to be on vitamin D. They'll say, you know what? We honestly just checked your vitamin D levels and they were great. I think you're getting everything through your diet. You don't need that supplementation. So it really can depend on what that medication or vitamin or supplement is and if it would be beneficial for you or not.
It always amazes me how much we can learn from getting our blood work done and having that guide some of the choices that we make along with our healthcare providers.
Definitely. I mean, I've heard some that will say, oh, taking vitamins and supplements just gives you expensive urine. And then I'll hear that. And then, for some, it really, if you have a deficiency, we certainly want to make sure we are supplementing that. So there really is some give and take with it. And we just have to look a little bit further, but we certainly don't want to just start some of those medications. And going back to dangers, some of those ones that also have high interactions are like your vitamin K supplements, ginkgo, St. John wort. Those are ones that have increased risk because they can have affect your bleeding or your clotting factors as well.
Mhm.
So you want to be cautious with that.
So I want to move us on to the subject of exercise, which I am very passionate about. I am a runner and I love to exercise. And I would love for you to help us share with the aging population. Should the aging adult remain active? I know my answer. And like how much exercise they should be doing and some of the best types.
Sure. So 100%, we should be exercising across our lifespan.
Mm.
I mean, just overall that exercise, how it affects your mental and physical well-being is just so crucial. I mean, we just need to be exercising. So ideally, you want to exercise 30 minutes a day, at least 5 days a week. Now, saying that is not to say that the person that does not exercise at all should go out and start at 5 days a week. I am not recommending that. And I also recommend for you to talk to your provider so that it can be once again, individualized for you, because various medications or various medical conditions, certain exercises may not be beneficial to you. But ideally, you want to set realistic goals. So if you're one, like I said, if you don't exercise at all, let's start at 3 days a week, or let's start at 2 to 3 days a week for maybe just 15 minutes. And you can work your way up to that end goal of 5 days a week for 30 minutes at a time. So various types of exercise, especially in the aging population. So the National Institute of Aging, they recommend 4 types, and that's endurance, flexibility, balance, and strengthening. And so with your endurance, that right there can be your brisk walk, your jogging, swimming, gardening, any of that that really can kind of, I know gardening maybe doesn't get your heart rate up as much, but anything that can really get your heart rate up and kind of provide some conditioning would be really good. And then there's strengthening as well. And that just kind of helps with your overall well-being. That can be anywhere from doing light weights. You can do cans, carrying in your shopping bags, any of that to help with your strengthening. Then flexibility, and flexibility is going to help you be able to maintain your activities of daily living. So just kind of doing your activities around the house, being able to care for yourself, being able to do your laundry, that flexibility will really help with that as well. And yoga, Tai Chi, those are a couple of things that can help with that. And that's not saying you have to go out and take a class. There are online classes that you can do, YouTube videos that you can do. So there are various ways around that. And then balance as well is good, because that helps prevent falls in the aging population. So you really want to work on balance, and that you can do through also yoga exercises or just kind of regular balance exercises, such as holding on to a piece of furniture and safely trying to balance with maybe one foot or with both, but making sure you're doing it safely and obviously what's going to help reduce you getting injured. So never try to do any balance exercises without a piece of furniture there for you to have a light touch to be safe. And I would recommend also maybe starting with physical therapy as well, because they can guide you through safe ways to do some of those exercises.
And I know after I exercise, I always just feel better. Even, and I'm not saying I feel negative going into exercise and then I feel positive, but at some point in time when I'm exercising, I just get that hit of endorphins and it just really helps me reset for the day.
100%. And one, you just feel so accomplished. Like, I got this done. What's next? What can I do next now to tackle my day? So, for me and with everyone with their busy schedules, sometimes I exercise in the morning and sometimes I exercise late at night. And they don't always recommend late at night because it kind of gives you that extra jolt for
True.
having troubles for going to bed. For me, as soon as my head hits the pillow, doesn't matter if I can go to sleep. But it's just a good feeling to have some exercises in. And actually, I want to send you a link to some chair exercises as well, because,
Perfect.
some people may have some physical limitations that may not allow them to kind of do some of the other exercises that we just discussed. However, there are some good chair exercises that can help with strengthening, that can help with just overall flexibility as well. So I do want to send that link to you. And it's from the National Institute of Aging as well.
And that's such an excellent point to bring up because exercise can be associated with running or just being at the gym for hours at a time, but it's not. I feel that it's more important to get the body moving and keep it moving, keep it limber so that you can maintain your independence as you age.
Exactly. And, it just helps with everything as well. I might talk to someone and they say, I've just been so tired. Okay, well, you have to get up and move a little bit. And that moving, if you don't, I'm not, automatically saying you're tired and you're not moving, but, if we have the discussion and then, after further discussing, we find out, okay, you haven't really been doing too much activity. Let's get you moving a little bit. And that overall helps with energy as well. So I definitely agree.
Now, what if someone is facing a health or a physical challenge? Are there some different types of exercises that person could do to keep their body active?
Sure. And that's where I also say, like, to go back to physical therapy again. So
Right.
physical therapy is very beneficial. And, just like you said, what if there's a physical limitation and the person can't necessarily leave their home? A lot of times they have physical therapy options that can come to your home and they can help you inside the home, which is really good because they can really individualize some of those activities that can help you as well. And then also looking at some aquatic exercises. They
Oh.
have silver sneakers at the Y, which is always really good too. So they have those various exercises that can kind of cater to your needs as well.
So, Kiristin, in closing, I do want to ask if there are any main takeaways that you want to impart on our listeners from this conversation that was so wonderful that we had.
Sure. I think just in general, the take home message is that adequate hydration and just exercising and having a well balanced diet in general makes us feel good. There's so much proven research that shows that this provides longevity and benefits to our overall health. You know, sure, we may be battling some of our multiple comorbidities or things like that, but we noticed that if we can make some slight changes in other areas, that may benefit us in the long run. So I definitely think just being mindful of these tips can really help you. And again, I don't think you need to hop from never doing something to now I have to completely change my lifestyle, but really catering it to you and setting short-term goals. And once you set those short-term goals and you attain those short-term goals, you can really feel good about yourself and then work towards your next goal.
Thank you for sharing with us that closing and just really how to feel our best as we age through hydration, nutrition, supplements, and exercise. I have a few new focus areas that I noted down, and I look forward to feeling even better than I already do as a result of this conversation.
Oh, good. Me as well. You always need the gentle reminders.
Yes, absolutely. Thank you for listening to Honestly Aging by VigRHealth. You can find links and show notes from this episode on our website at friendslifecare.org/podcast. Thank you to Kiristin Briggs for joining us today. You can learn more about Kiristin on LinkedIn. If you like our show, please rate, review, subscribe, and join us next time. To learn more about aging with vitality, independence, growth, and resilience, subscribe to our blog at friendslifecare.org/blog.